The topic for my class today is on class 1 amalgam tooth preparation technique. So generally, class 1 refers to the restorations, that is cavity that is present on the opposite surface of the posterior tooth and opposite 2/3 of the facial and lingual surface of the posterior tooth. And in case of anterior tooth, it will be on the lingual surface of the anterior tooth. So class 1 is generally the preparations that is confined on the opposite surface of the posterior tooth and as well as the lingual or the parietal surface of the anterior tooth. So the basic techniques for a class 1 preparation is, that is for basic fundamental preparation techniques are the initial and the final stages. So the initial stage of a tooth preparation is defined as an establishing the outline form by extending the external walls of the cavity to a sound tooth structure while maintaining the specified limited depth as well as providing the sufficient resistance and the retention forms. So for an amalgam cavity operation, the burrs that is used will be the 245 burr. So the outline of the burr gives the sufficient resistance and retentive features, that is it has got an inverted shape, so which gives the retentive features, and the angles are rounded, which gives the rounded line angles and point angles. So this is the basic burr that is used when preparing the amalgam cavity operation. So the first stage is that a punch cut has to be done using a 245 carbide burr at high speed with air water spray in the involved cages pit. So the tooth for reference is the premolar tooth. So the most cages pit has to be started first using a punch cut, and the orientation of the burr should be parallel to the long axis of the tooth. And while doing the punch cut, you have to give the proper depth of 1.5 millimeter, which has to be measured from the central fissure of the tooth. And depending upon the cuspal incline, the depth ranges from 1.5 to 2 millimeter. And into the dentin, the pulpal depth should be 0.1 to 0.2 millimeter. Once the cavity is started from the mesial portion, it has to be extended on the distal margin ridge, including the caries, the fissures. And the burr has to be tilted to create a slight occlusal divergence to the distal wall in order to prevent the undermining of the margin ridge of its dentin support. So ideally, the margin ridge thickness has to be maintained at 1.6 millimeter. If it goes beyond that, the burr has to be tilted distally. So the burr orientation and depth has to be maintained and has to be extended distofacially and distolingually to involve the supplementary grooves. And there has to be extended along the central fissure towards the mesial pit following the dentin enamel junction. The pulpal floor should follow the DEJ, maintaining the uniform pulpal floor depth. And the width of the isthmus of the cavity should be just wider than the diameter of the burr. So the conservative final cavity outline should have a gently flowing curves with a distinct cavo surface margin. So the outline shapes of the tooth actually varies depending upon the shape of the fissures. So for the maxillary first molar, the shape will be a kidney shape. While in case of a mandibular first molar, because of the deep pits on the deep pits present, the shape of the cavity resembles a snake eye. So it can be called as a snake eye shape, and it will become a butterfly shape when the central fissure is involved. So the shape will eventually turn into butterfly shape. And for a mandibular second premolar, because of the groove that is extending on the lingual surface, it assumes a Y shape. And for a mandibular first molar, involving all the grooves, the shape will resemble that of a bat. And for a mandibular second molar, the shape will be more like a plus shape. So for the initial tooth operation, the pulpal floor depth should remain at the initial depth, that is 1.5 to 2 mm. And the remaining caries has to be removed in the final cavity operation. So while doing the initial cavity operation, one has to give the sufficient resistance and retention features. And the primary resistance features are the flat pulpal floor, minimal extension of the external walls, strong enamel margin, and a sufficient depth of 1.5 mm to resist the fracture of the restoration. And the primary retention feature is the occlusal convergence. Next is the final tooth operation, which involves the removal of the remaining infected dentin, which can be done with the help of a discoid cleared spoon excavator or a slow rotating round carbide burr of the sufficient size. So the pulpal protection that has to be established depends upon the depth of the cavity. If the depth of the cavity is greater than, that is the remaining dentin thickness is greater than 2 mm, a varnish is sufficient. If the RDT is 0.5 to 1 millimeter, then one should place a thin layer of RBIC base. And if the remaining dentin thickness will be less than 0.5 mm, a calcium hydroxide liner has to be applied, followed by base and varnish. Base should be applied only on the pulpal floors. And the butt joint of the amalgam should be 90 degrees. So after all these two operations, the cavity should be inspected and cleaned before restoration. It should be free from debris. So some of the variations in the classroom cavity is that one is the first is occlusolingual amalgam restorations. This is done when there is a groove that is extending occlusally, that is facially or lingually. So the preparation somewhat resembles a class 2 cavity preparation, except that the groove is extending on the facial or the lingual surface, extending till the occlusal thirds, that is the facial or lingual third. So the angulation of the axial wall should be parallel with the external walls. The axial wall depth should be 0.2 to 0.5 mm inside the DEJ. And the axiopulpal line angle that is formed should be rounded. And in this case, one must use a Toffemeyer matrix retainer and a band. And the matrix band technique is known as Barton's matrix because one has to, the proper condensation of the amalgam can be done only if you use an extra piece of band, and the wedge has to be inserted between the first band and the segment of the piece of matrix band, and the wedge has to be coated with a combo. So this type of matrix system is known as Barton's matrix. It is to be used in a occlusolingual amalgam or occlusofacial amalgam restorations. The purpose of coating the wedge with compound is that we can reshape it. That is, with the help of a heated ball burnisher, heat can be transferred through the matrix material to the compound in order to provide a proper contour. And another variation is a buccal or a lingual pit, which is the pit that is seen on the facial or lingual surface, which is also a key susceptible area. And the other is the occlusofacial extension, which is similar to that of an occlusolingual extension. And coming to the restorative techniques, amalgam has to be mixed using a pestle, a mortar and pestle, and the trituration has to be done, and the excess mercury has to be squeezed using a squeeze probe. And the correctly mixed amalgam should not be dry and crumbly. It has a minimal and sufficient wetness to avoid in order to achieve a homogeneous adaptive restoration. So the instrument for carrying the amalgam is an amalgam carrier, and the increments should be extruded from the carrier. That it has to be only smaller, that is only half or less of the carrier tip has to be used. And with the help of a flat-faced circular or elliptic condenser has to be used to condense the amalgam onto the pulpal floor. Initial condensation should be small enough, that is the size of the condenser should be small enough to condense into the line angle, but should be larger in order to avoid poking hole into the amalgam mass. So the amalgam has to be restored incrementally. It should not be restored as a single increment, but it has to be restored using small increments. And each condensing stroke should overlap the previous condensing stroke to ensure a good condensed mass. And the final packing of the amalgam, that is the preparation should be overpacked, that is 1 mm should be above the cavus surface margin. This ensures that the cavus surface margin are completely covered with a well condensed amalgam. So in order to ensure that it is well condensed before carving, and it has to be burnished with a large burnisher using heavy strokes. That is, a large burnisher with heavy strokes should be used for burnishing, which is known as pre-carve burnishing, which is a form of condensation. The purpose of the pre-carve burnishing is that it produces a denser amalgam at the margins of occlusive preparation. It also helps in further carving. And the further contouring and finishing of the amalgam, that is, a sharp disc-colored instrument can be used for as carvers, and different warts carvers can be used. And the carving should be done in such a way that the edge of the carving instrument should be, that is, blade should be perpendicular to the margin as the instrument is moved parallel to the margin. And the part of the carving blade should rest on the unprepared tooth surface adjacent to the preparation margins. And this way helps to prevent the overcarving of the amalgam at the margins and provide a continuity of surface contour across the margins. The carving should be done in such a way that it should prevent the undercarving, and also it should prevent the overcarving. And undercarving leaves thin portions of the amalgam which is subjected to fracture, and the amalgam should not be overcarved also. So after carving, the outline of the amalgam should reflect the contour of the cavus surface margin. And following the carving, one should do the post-carve burnishing, which is done by lightly rubbing the carved surface with a burnish of suitable size and shape, which improves the smoothness and provide a satin appearance. So after carving, most of the amalgam do not require a further finishing and polishing. These are occasionally done in order to complete the carving, refine the anatomy, contours, and marginal integrity, and enhance the surface texture of the restoration. And additional finishing and polishing, if required, should not be done within 24 hours of insertion. So, thank you.